Hello everyone. In today's video, we will discuss the lateral supramalleolar flap. This flap is used to cover defects over the dorsum of foot, ankle, distal, tibia, Achilles tendon. The advantage of this flap is that the flap is a very thin flap, pliable tissue, and has a good color and texture match. Now we discuss the anatomy, arterial supply of the flap. The flap is supplied by the perforator of the peroneal artery. This perforator gives the ascending branch and descending branches. This descending branch anastomoses with the anterolateral malleolar arteries, which is a branch of anterior tibial artery, and directly with anterior tibial artery, forming a very good vascular arcade. Now we discuss the landmark. For the sake of ease of discussion, we will select a dorsum of foot as a wound which we will cover with the flap. First we will mark the lateral malleolus, then we will mark the head of fibula and we'll draw a line joining the 2 points. After that we will mark the pivot point. Pivot point is 5 cm above the lateral malleolus. This is the site where the perforator is coming out of the interosseous membrane. This will mark as the pivot point. When we will raise the flap, we can never go beyond the pivot point. So it also serves as the inferior edge of the flap. After that, we will mark the lateral border of the tibia. So there will be 2 parallel lines and will decide the width of the flap. We have to make sure that when we are designing flap does not give outside these 2 parallel lines. It can go beyond the posterior line to some extent, but it can never cross the anterior line. Coming to the upper limit of the flap, some textbooks mention about the 50% of the length of the line joining the lateral malleolus and the fibula head, and some textbooks consider 2/3 as the safe limit. After that, we have marked the pivot point. We will measure the distance of the pivot point and the wound, and this serve as the length of our pedicle, and we will retrospectively draw the defect on the normal skin, and we will mark the extent of the pedicles. Pedicles should be about 3 to 4 cm width for adequate arterial and venous drainage. After marking, we will raise the flap and rotate and cover the defect. The raw area developed will be covered with SSG. Thank you.